So today I am given ketorolac to give to my patient. So with that medication, I would make sure that I'm checking the kidney values, so the BUN and creatinine, and I check those beforehand and they are at the normal level, so I'm able to give ketorolac today. First, I would make sure my client is in a comfortable position, and then I would state 3 questions about each of the medications I could give. So for Fluzone, I would ask if they had an allergy to eggs or have been exposed to the flu recently. For ketorolac or Toradol, I would ask if they are in pain and when the last time they've had it is. And then for morphine, I would also ask if they were in pain and when the last time they've had it. Then I would do the pain assessment, and then I would state 3 places an IM injection can be given. So one is the deltoid acromion process, and that is here. And then another one is your vastus lateralis greater trochanter, that's the hip. And then the last one is the lateralis femoral condyle, and that is above the knee. And then after that, I would hold any medication per nursing judgment. I will verify my MAR and my provider order. So here I'm looking for ketorolac, and then I'm on here. Okay, so I'm gonna compare my provider order and my MAR. I'm looking for the right patient, which is Joe Smith, and then the right medication, so it's ketorolac, tromethamine, Toradol. Right dose would be 30 milligrams IM every 6 hours PRN for moderate to severe pain, and the status is active, so it's able to be given. It has not been given yet today, so I'm able to give it. I can give it every 6 hours, and like I said, it hasn't been given, so I'm able to give it. And then I would put my provider order away and just have my MAR out. And then I would gather my necessary equipment. So my medication is in my drawer for when I get it out for the first med check. I would make sure my packaging for my tools are intact, and today they are open just for practicing purposes. Today I will be using a 1.5 inch 22 gauge, and that is because it's appropriate for what I'm given today and my patient's age and size. I would ask my patient if they have a preference on what hip that's going to be given today, and for the purpose of today, it is going to be given on the right hip. Okay. Alright, so now I am going to do my first med check. So first I'm going to get it out of the drawer, and then I would make sure it's the same as my MAR, and I would also show my instructor to make sure it's the same medication that I need to be given. And then I would look at my MAR for right patient, which is Joe Smith, right medication, which is ketorolac, Toradol, their correct dose and the correct dose calculated. 30 milligrams IM, so right route, every 6 hours PRN for moderate to severe pain. For today's purpose, I'm just going to be given 1 ml of ketorolac. So I did all my right checks, and then if it was for using a single dose vial, I would check the expiration date. For a multi-dose vial, I would check the expiration date and the date opened, as it can only be open for 28 days. If it was my first time opening a multi-dose vial, I would label it with my initials, the date and the time. I would check the integrity of the vial and make sure nothing is floating inside of the vial, so it looks good. Okay, and then next I will do my second med check. So I'll just do right patient, which is Joe Smith, right medication, which is ketorolac, Toradol, right dose calculated, 30 milligrams, IM, route, time is every 6 hours, PRN, and the use is moderate to severe pain. For Joe Smith, it has not been given yet today, so I'm able to give it. And then again, if I were to use a single dose vial, I would check the expiration date. If I were to use a multi-dose vial, I would check the expiration date and the date opened. It can only be opened for 28 days. If it was my first time opening a multi-dose vial, I would label it with my initials, the date and the time. And I would check the integrity of the vial and make sure nothing inside is floating or unusual. And then now I will do my third med check. So I will enter the client's room, knock knock. Hi, my name is Jenna, I'm your nursing student. Can you please verify your name and date of birth? I would look at their wristband to make sure it's the same. Provide hand hygiene. Come over here. And I would provide privacy. Just gonna grab this. And I would provide privacy. For PPE today, I need normal gloves. Those on. And then today your provider ordered, or I would ask for allergies. Do you have any allergies? I would look at the allergy band as well. Then I would do my PPE today. I just need gloves. And then I would explain what's going to be done and what the provider ordered. So today your provider ordered, we do a ketorolac injection, IM, and that is for pain. So that's just going to entail me asking you some questions, explaining the procedure, and then giving you that shot for pain today. So then I would scan the patient's wristband, and I would also scan the medication that's going to be given. Scan, good. Move this stuff over here. Scan the medication, and then I'm going to do my third check at bedside. So I will do right patient, Joe Smith, right medication, ketorolac, Toradol, 30 milligram IM, every 6 hours PRN for moderate to severe pain. And it has not been given yet today, so I'm able to give it. Today we are doing the, the route is going to be the greater trochanter, and we're doing that because it's the best absorption place for this medication that's going to be given. And then after that, I'm going to open and prepare the medication in front of the client. The client has the right to refuse and know what they're being given, so I'm going to explain that to the client. I need my cards.
Just grab them.
Will you grab them so I in my binder? She just forgot her one pager, so I grabbed it. I'm just gonna find catalog. Okay, so I would open in front of the client, have my necessary equipment gathered. I'm just going to say the action of this medication in layman's terms. So it's just an anti-inflammatory drug that it treats pain, reduces your inflammation. Some common side effects are dizziness and drowsiness. Can you teach back what I just told you about the medication? Have them teach it back to me. And then I would ask if they have any concerns before we get started. So first I would just pop this off and clean for 30 seconds. Okay, 30 seconds. And then I would take this and keep it sterile, so I do that. And then I'll pull back. Today I'm gonna do 1 milliliter because of the purpose today. I don't have someone tell me how much I need, so I will draw that back, and then I'm just gonna set that there. Stick it in my vial. Put the air in, and then I'll turn it. Make sure I have the correct amount with no air bubbles. And then I would show my instructor that I have the correct medication. Tip it back upside down, take it out. I would do the one-handed scoop. And then take that off. And then keeping it sterile, I would attach that. Do that. So I told you the action, side effect, had you teach it back to me. Asked if you have any concerns before we get started. You didn't, so I am going to just find where I'm going to be giving the shot. I would hold the skin taut, so pull the skin back. I would go in a circular motion for 30 seconds. And then I would place that right above so I know where I cleaned. I would let it dry for 30 seconds. Get my medication, pull that off one-handed, hold it like a dart. And then once it dries, I will insert it at a 90-degree angle. I will inject the medication slowly, about 10 seconds per milliliter. So I will inject it for about 10 seconds as I'm only giving 1 milliliter. Do it nice and slowly. And then I'll leave it in there for 10 more seconds after I'm done administering it all. Then I'll take it out nice and slowly. I would put this on the safety. I would do it on a hard safety surface, and then put in a sharps container. For practicing purposes, I'm not going to pull the safety yet. And then I would hold a 2x2 gauze there with pressure. I would assess if a Band-Aid is needed. And then I will take my gloves off and throw that away. And then I would do right documentation. So I would report any norms per agency policy or any concerns that I saw today. I would reassess for adverse reactions in 10 to 30 minutes. If there were adverse reactions, I would withhold any further doses, contact the provider, contact the pharmacist, take the vital signs, and document per agency policy. I would thank my client. Do you have any, can I do anything else for you while I'm here? No. I would gather and clean up my equipment and take with me. And then I would do the 5 safety measures. So I'll make sure the bed's low and locked, side rail secure, call out within place, bedside table near, room risk-free of falls. I said I'd gather and clean my equipment. I'll do hand hygiene, 5 moments before patient, after patient, before a procedure, touching patient belongings and coming in contact with bodily fluids. We'll document in OneNote and, like I said, report any norms per agency policy. Thank you.